Big extrusion sticking out of your lower back, causing lots of pain, and you want to know, should I have surgery or not? If any of that sounds familiar, then you're in the right place. My name is Anthony Wade. I'm a physician assistant, and in this capacity, I'm more of a natural health coach, and I help people who's had MRIs and are confused about what are the findings and what are the next steps that they need to do. Maybe they had someone that explained it, but they didn't do a very good job, and you need answers. Well, in today's breakdown, we're going to be going over a guy that has a big extrusion in his lower back, and he's contemplating whether or not he should have surgery. If you've ever had an MRI before of your neck and your back, and maybe you've seen a provider and that provider was quick about the explanation, or maybe they said it was all bad, or they said it was all good, and but you're still in pain, well, this is the place that you come to for answers. Again, my name is Anthony Wade, and unfortunately, I do not have all of the images from this person's MRI. When you do an MRI, it takes many slices or pictures of the MRI, and I'm able to get a hold of that and upload it to my computer. But at this point, all we have is a still picture, so we're gonna work with what we got. We got one picture, but it's a good one. It shows what's going on, and we're just gonna work with it. But again, our guy, he's had this herniation for a while, and well, we're gonna find out what's going on with him. Before we do, I must let you know that this is only for informational purposes only. Again, I've never talked to this guy. I've never did an MRI, an exam on him. So I don't know exactly all the stuff that he's going through, except for what he wrote, which we'll go over in a little bit. But again, you have to take this with a grain of salt. This is only for informational purposes only. You take this information and use it to have better questions for your provider when you go back to see them. My goal is to educate you and empower you with the right information and maybe some options, and just to get I wouldn't say a second opinion, but somebody else's opinion on the images that we see. Because again, I only have one still picture, so it's impossible to be able to see it fully and completely to give you more accurate information. But let's roll with what we got. So let me pull his information up here. All right. So this is a 26-year-old male with a large L5-S1 disc extrusion. That's basically the bottom portion of the lumbar spine. It's sticking out, and you'll be able to see that in a little bit. Um, he wants to know, can he recover without having surgery? So I'm 26 years old, very active until recently, playing soccer and even sprinting 5 kilometers about a month ago. I previously had an L5-S1 protrusion, meaning it was sticking out, but it wasn't sticking out that far. And at the age of 24, that was like 2 years ago, and he recovered fully with conservative treatment, rest, epidurals, and return. He was able to return back to his sports pain free. Now he has a big, large L5-S1 extrusion that's sticking out. It's causing him pain mainly in his inner thighs and glutes, with some numbness into the foot. And it's worse in the mornings. And let's see, for about the first 30 minutes, it's very painful. Sitting for more than 20, 30 minutes is difficult. Pain is mild during the day and at night. So it's mainly in the morning time that is bothering him. And he's able to walk 12,000 step, not 12,000, 10,000, excuse me, 10,000 steps without a problem, which is a good thing because walking is good for the back. Um, he has no weakness and can stand on his toes normally. Let's see. He went on to say about a month ago he was sprinting. Now even sitting is hard, and he's having a pretty tough time. So he wanted to know, has anybody ever had a large extrusion and recovered without surgery? So that is the main question that he has. and let's take a look at his MRIs. All right. Hopefully you can see this. This on the right side of the picture where it's dark, that's his back there. On the left side of the picture is going to be the stomach area. Right in the middle, if you look, there's a column there that is the bone is kind of grayish. In between is some white looking discs that are horizontal. Those are the discs, those white areas. And in the back of that is the spinal cord. It's a little bit you can see it there. Unfortunately, I haven't labeled this out or able to point it out to you, so you just have to follow along with me. But if you just scroll down to the bottom there, you see that last level that's darker. All the other levels are light. That last level is dark. Is also collapsed down some. There's some degeneration there. The disc, meaning is collapsing down. The best way I like to describe herniations is like a burger. You squeeze the burger and the meat sticks out on the other side. That's basically what's going on. His meat, as you can see, or disc is sticking out pretty far. That is a pretty impressive herniation or extrusion at this point because it's sticking out a whole lot more. Just to tell you the difference, let me see if we could go back to me. Okay. Just to see the difference, if you have like a tube of toothpaste and you grab it on both ends and just squeeze it a little bit, you're gonna get a little bump. That's a like a bulge. If you grab it again and really twist it and push it in, it's gonna have a much larger bump there. That's more of a protrusion or herniation. Now, if you took a razor and you sliced it down the middle and then squeezed again, it's really going to stick out then, and that's an extrusion. And that's what this guy has here. And the question is, does he have to have surgery? And that's that question is always is it depends. It depends on what's going on with the person. It depends on specifically how bad is the pain. It depends on what are the other symptoms is he having. Is he's having any symptoms going down his legs? Is the pain unbearable if it's getting in the way of his lifestyle, his work? All these questions are there. um, are the symptoms getting worse or are they getting better? All these things you have to ask before you want to consider surgery. You also want to know, what conservative treatments have you done? There's different stretches and exercises you can do, yoga, tai chi, Pilates, acupuncture, all that stuff you can do. There's also injections, which he has had in the past that did help. There's epidural injections and facet injections and medial branch blocks and RFAs. There's a bunch of other procedures you can do before you get to the point of do I need surgery? And, I've said this before, when you're considering surgery, you have to consider, have you done all that other stuff? Is the pain getting worse? Are there symptoms going down into my legs that are getting worse? If all these questions are yes and yes and yes, it starts to point more towards a person possibly having surgery. But you want to definitely exhaust all the natural stuff that you can try, all the conservative stuff that you can try first. So, that would be my answer to this person. There's a lot more questions though before I'd be able to actually give an answer that I have to know about his condition and what's going on. Actually, he states that it's only bothering him more so in the morning times and throughout the day, it gets better. That kind of leans towards possibly trying a lot of conservative stuff before you'd want to rush to surgery. Listen, I've seen people with huge herniations, kind of like this guy, but have no pain at all. And I've seen people with little small bumps, and you think they're on their deathbed. So it really depends on the person. Our bodies are very dynamic, and at the end of the spine there, at the bottom of the spine, should I say, the spinal cord starts to feather out. Think of a broom with the brush at the end. That's basically in a long brush. The nerve fibers, it's no longer a cord, it's a lot of feathers. And because it's a lot of feathers and stuff down there, or I say feathers, but strings, not feathers, strings, you're able, even if there's a herniation or extrusion sticking out, uh, it doesn't necessarily is going to press on a big cord, because there is no big cord there. There's a bunch of little cords. So it really depends on what's going on. It can also depend on the size of the canal that the spinal cord goes through. Not everybody's canal space is the same. Some people have a congenitally small canal space, and some people has a bigger canal space. All of those things play a part in this person's pain and whether or not he has to have surgery. Even if you compare apples to apples with one person and the next person, they can have totally different symptoms, even though their MRIs look totally the same. So, all that to say, exhaust all the other natural stuff and conservative stuff that you can do first, and then really ask those hard questions about your symptoms and are they getting worse, to determine if, surgery is the next step. But w- we have actually a follow up on this guy. He stated that, let's pull it up here. All right. So let me see. Oh, that's the wrong one. I'm sorry. Uh, so I posted this last week. I got approved for the surgery. So he did get, he must have talked to a surgeon and got approved for it. But in 1 week, or was it 3 weeks? I believe it was about 3 weeks, his pain has already improved. So since it first happened, 3 weeks later, the pain has gotten better, and he's gotten almost all of his strength back. The morning stiffness is there, but getting much better. The pain level went from a 9 out of 10 now to a 6 out of 10. He's walking still. He's standing up with no problems, drinking a lot of water. And he states that that has been the key for him being able to continue to walk the whole time and to help improve himself. So it shows you right there, it really depends. This guy has been through this before. It was actually not as bad the last time, and he was able to do some conservative treatment. He did get an injection, an epidural injection, which helped out. That was like 2 years ago. The herniation got worse, but still his pain has improved. Now, will he have to have surgery in the future? I don't know. I don't have my crystal ball to be able to give you that answer. But, the best thing is to continue to stretch, continue to exercise, continue to build up your core, which is your obliques, your back muscles, and your stomach muscles, all that, your natural back brace. Those are the things that you want to strengthen in order to give yourself the best chance. So that's pretty much it for this round of MRI breakdown. I hope this has been some type of benefit for you. My goal is always to empower you, to educate you, and to give you, the resources that you're looking for and the understanding that you're looking for when it comes to MRIs. I know a lot of times some of my colleagues rush through the explanation. Some of them don't know how to explain it very well, and others, they just get it and send you off to somebody else without even going over it. So that is my goal, to bring some clarity to you. If you have your own MRI and you've gotten it recently because of an injury, or your pain is flared up or whatever, and you need some help, you want some personalized information and clarity, I do offer a service where I'll leave some information for you to click the link to find out about it more. But I will take the time and actually get your images. You'll have to send them to me. I can upload them into my system, my computer. We'll hop on a Zoom call or something, and we will pull up the images and look over them slide by slide, go over the report line by line, and I will help break down and give you some clarity about what's on the report so you can understand what you're dealing with. We'll go over some treatment options that are out there, natural treatments, and all the other stuff that's out there. not telling you what to do, but giving you the information so you know and understand all of your options, so you can take that information to your trusted provider, surgeon, whoever, and you'll be better equipped to be able to ask better questions to get better answers and know what you need to do in order to get better. So that is my goal, to help you and educate you to be able to have a better understanding of what you're going through. So again, I hope this has been some type of benefit for you. I've had a ball doing it. I can't wait to do it again with you soon, and I will see you sometime soon. Talk to you guys later.